Hello, it's September the 5th, Friday, and here we are at the end of the second week of the semester. I hope all is going well. I don't see too much discussion up there. I hope that everyone is having an easy access to the site. Be sure to let me know by email any difficulty that you might be having. So it's important. That discussion is important. That is our virtual seminar table. We're undergraduates, but we're seminaring, shall we say. Those discussions are important pieces of the course. Not really emphasizing the requirement of the discussion, although that's out there, but really is an opportunity to share ideas with one another and with me about the topics at hand, particularly now in this segment of the course, the demographic background. The demographic background is got a couple of things that we're doing with that. One is just to see how the demographic events, births and deaths, are used to indicate population health. All the articles in there deal with that sort of thing. And the other part of it is a number of those articles were written before the real emphasis on contextual influences, on social determinants of health, on the upstream view. So it becomes a kind of an intriguing prospect to read the articles and find the contextual explanations for the population health outcomes that you see in the articles. Sometimes they're there, but just subtly more implied than forthrightly stated. So that's what mining for the gold is looking for the gold of the ZI. Remember, we're Y, the variation of population health, and as we go upstream, up the equation to the right, we go through individual level factors that contribute to population health, to group factors like race and ethnicity that contribute to population health, to context, or in our case the ZI in that equation. What are the factors in the environment, the neighborhood, maybe the time in terms of this year as opposed to 20 years ago. But what are the ZI influences? Those are we're really after the Y equals ZI, our relationship. So I just posted assignment 1. You'll see it up there. Go out and look at the announcement and see how the assignment reads. I wanted to highlight a couple of things that go back a week or so from what we were doing in the introduction. When you look at that social ecology of health, there are some notes posted on the things that I'm talking about right now. When you go back and you look at that social ecology of health PowerPoint, there you'll see the maps that became kind of the central part of my dissertation some years ago. When we were trying to understand in those days, that was about 20 years ago, we were trying to understand the causes of infant mortality in San Antonio, the differentials, race and ethnic differentials. And they weren't readily available on the kinds of data and information you get on a death certificate, infant's death certificate. So I went into having just finished a public health master's degree, rolled up my sleeves and went into the archives of the city of San Antonio. I was doing this as my dissertation. It was like San Antonio was a case study. I went into the archives and looked at the sanitation, distribution of the sanitation infrastructure, and found that in those areas of the city where infant mortality was high, the infrastructure was low. And the inverse, where infant mortality was low, infrastructure was high. And that's diarrhea-related infant mortality. So from there I concluded that likely what was happening is that the children in areas where infant mortality was low, I should say where infant mortality was high, and the health infrastructure was low, sanitation infrastructure was low, that there was a higher probability of contaminants in the soil, a higher probability or higher risk of infection, a bacterial infection, and consequently diarrhea-related disease, dehydration, and death. And that was what my dissertation was about. And you'll see those maps. You see the stars that represent the individual deaths in 1939. If it were something that were just random, then those stars would be randomly distributed across the county. But they're clustered in areas of the city, large clusters in one case. And so then the issue becomes what was the upstream, shall we say, what was the context that was leading to that? If they're varying in in number across the city, and they're not random, then what was the contextual influences that produced that cluster in this part of the city, and what was the contextual circumstances in this part of the city where there was no cluster or very few infant deaths. So that got me thinking about the contextual influences. What got me into sociology. I was in the doctoral program of sociology at the time, even though I was at the Population Research Center, and became a graduate of that and a population analyst. So that really introduced me to the whole idea of I had an epiphany, shall you say, of the value of the sociological perspective of contextual influences on behavior. There's another set of maps later in that same PowerPoint that have to do with Houston and intrauterine growth retardation. There's an article in the readings for the segment by Frisbee and all. He was my dissertation chair, by the way, a remarkable guy. But anyway, in there, intrauterine growth retardation is basically a child that is born full term but low weight, birth weight. Generally speaking, children that are born low birth weight are preterm. They're not the full 36 weeks. So what was the reason why children born full term were low birth weight? So a graduate student that I was working with then at the School of Public Health put together the idea that maybe it was contextual influence. Maybe there was social dysfunction in certain neighborhoods of Houston. As you'll see there, it was the index of social disadvantage. Where that disadvantage was high, the intrauterine growth retardation would also be high. The idea here being that if there is social dysfunction, the mother is stressed, and to the extent that she's stressed, perhaps that affects adversely the energy that she would ordinarily pass on to the fetus is withheld in some way for own survival, shall we say. And so those children are born, but they're born smaller than they would ordinarily be for a child born full term. So that's another upstream contextual influence illustration that's in that, and the article is in the readings. You'll see it, I can't think of the title of it right now, but intrauterine growth retardation, and Parker Frisbee is the lead author. So those are two illustrations of that. Now, the other thing I would like for you to do, there is a note posted on this, and the second chapter is by Eric Bruner and Michael Marmot, and it is Social Organization, Stress, and Health. In the specific article that Bruner has written that's in that first segment, you'll see both here in this book, in that chapter, and in that article is a discussion of the, shall we say, physiological, biological plausibility of the equation that we're discussing here in this course. That is the theme of the course. If the context is dysfunctional, then it's reasonable to conclude that that increases stress. And if stress is high, then perhaps there's an adverse consequence for the autoimmune system. So as a consequence, it becomes impaired, makes an individual more susceptible to infectious disease and perhaps even to chronic disease. And then you have the health outcomes downstream of those two processes. So look at the Bruner article that's in the readings. Look at the Bruner and Marmot chapter 2 in the book, and then I've done a note, Prof's note specifically on the Bruner article and on the idea that Bruner brings forth to us about the biological plausibility of the social determinant equation. All right. So the other thing I want to mention in this video is that mining for gold. You'll see some notes. The mining for gold is reading these contextual. Looking for the contextual influences on the population health outcome in these basically demographic articles of segment 1. Mining for gold is looking for the ZI. It's looking for those moments in the places in the articles where the authors emphasize, if they do at all, or maybe only say in passing, or maybe only imply, that there's a contextual influence on the population health outcome they're examining. Get that discussion, get that theme in the discussion. I have that as your discussion. As you're reading these articles, get into discussion and talk about the mining for gold. What do you see as context? And talk about that among yourselves. So thank you very much. And sorry about this video not coming out last week. And it is a video for this week, and I'll try to get better at this. So thanks a lot. And there's a weekend. Today's Friday. You all be safe and careful out there. Talk to you next.